Question 1. A 68-year-old female patient comes to your clinic complaining of progressively worsening pain in her right hip, which began 2 days ago. She is unable to bear weight on the affected limb due to intense discomfort. She denies having any previous joint disease, but has been on chronic oral corticosteroid therapy for a systemic autoimmune condition. On physical exam, movement in the right hip is severely limited and painful in all directions. Which of the following is the most probable diagnosis? A. Gout. B. Avascular necrosis of the femoral head. C. Hip osteoarthritis. D. Septic arthritis. E. Bone metastases from a primary malignancy. Correct answer. B. Avascular necrosis of the femoral head. Explanation for script narration. This patient presents with acute onset hip pain and inability to bear weight, in the absence of trauma or known joint disease. Her significant medical history includes long-term corticosteroid use, which is a major risk factor for atraumatic avascular necrosis, AVN, of the femoral head. AVN occurs due to compromised blood supply to the femoral head, often linked to chronic steroid therapy, alcohol abuse, sickle cell disease, prior fractures, liver disease. In elderly patients, especially those with risk factors, AVN should be high on the differential when there is sudden, severe, non-traumatic hip pain with limited range of motion. Let's break down the alternatives. Gout. A. Rarely affects the hip. It's more common in small joints like the toes or ankles. Osteoarthritis. C. Has a gradual onset, not acute and disabling like in this case. Septic arthritis. D. A possibility, but the patient shows no signs of systemic illness, e.g., fever, malaise. Bony metastasis. E. Usually presents with chronic pain and history of primary malignancy. Neither is evident here.